Gastrointestinal motility pathophysiology. What is gastroparesis? Gastroparesis is impaired contraction capacity of the stomach, which results in defective gastric emptying. In order to understand gastroparesis, let's first look at the normal physiology of digestion. The vagus nerve, or cranial nerve number 10, innervates the stomach via the autonomic nervous system. The ANS has a sympathetic branch and a parasympathetic branch. When the sympathetic nerves are stimulated, the response is in preparation for a burst of activity which is supported by shunting blood from the digestive system to the skeletal and cardiac and respiratory muscle tissue, as well as stimulating glycogen release from the liver. The parasympathetic and enteric nerve support digestion through the release of neurotransmitter acetylcholine. Acetylcholine has an excitatory effect on the smooth muscle contractions. It also stimulates the release of enteric hormones as well as dilation of enteric blood vessels. What causes this very complex and efficient system to dysfunction? Let's look at that a little closer. Diabetes mellitus is one disease that affects all body systems and is often the cause of gastroparesis. When the nerve cells experience prolonged exposure to elevated glucose, they become deranged. This is a consequence of poorly controlled blood glucose levels, often after very many years. Hyperglycemia also exerts damage to the blood vessels. Most pronounced effects are seen in the smallest vessels. For those people without a known explanation for the damaged nerve and blood supply to the stomach, these are identified as having an idiopathic gastroparesis, meaning it occurred spontaneously but with poor understanding as to why. Some studies suggest a viral insult, others nervous system insult, but little support for the cause is really evident. Gastroparesis, then, is a pathology of both nervous and vascular physiology of the stomach. This understanding may make the available management modalities make a little bit more sense. Let's talk about that now. Foods that are high in fat require ample bile for digestion, and this need stimulates delayed digestion to accommodate the fat digestion. Foods that are spicy actually slow digestion because they confuse the receptors, resulting in reduced digestive stomach acid or hydrochloric acid, which also slows digestion. Alcohol and smoking naturally slow stomach emptying, making the impaired motility more pronounced. Counseling patients to avoid carbonated beverages, as well as not eating and drinking during the same sitting, will also help to relieve symptoms associated with gastroparesis. High fiber diets, particularly soluble fiber, examples like oatmeal, oat bran, brown rice, flaxseed, these types of fibers attract water and create a sludge in the gastrointestinal tract that delays the stomach emptying. Now, please note, normally these types of fiber are very good for sequestering cholesterol, but not for someone which has delayed stomach emptying. And lastly, as you might expect, eating smaller meals allow the stomach to more efficiently do its business of digestion. Some of the pharmacology, some of the pharmo, pharmo, some of the pharmacotherapy modalities used for treating gastroparesis include medications designed to help better regulate the blood glucose. If you can control hyperglycemia, this is going to reduce the damage to the cells and prevent progression of the illness. Another medication is metoclopramide. The trade name is Reglan. This medication helps to enhance the response of the gastrointestinal tissue to acetylcholine, but it does it without stimulating secretions, which would also damage the lining of the stomach. So this is a very good option if the patient isn't allergic. Macrolide antibiotics. These medications stimulate fundal contraction. So this works by making the stomach actually move so that the food can be digested, thereby making gastroparesis less pronounced.